So, if you're a new parent, you might have heard people talk about strawberry marks, those bright red spots that can sometimes show up on a baby's skin. But what are they really? Today, we're going to break down exactly what these marks are, how they behave, and most importantly, when you might need to pay a little closer attention. It's a pretty common sight, isn't it? You see this tiny, harmless-looking mark that just kind of appears a few weeks after a baby is born. But what is it really, and does it just, fade away on its own? That's the big question we're going to tackle. All right, so let's start at the very beginning. Section 1, a mark appears. Because the first step for any parent is just to understand what it is they're actually looking at. Okay, so this is what we're talking about, an infantile hemangioma. Now, I know that word tumor can immediately sound pretty scary, right? But the most important word here is benign. It is completely non-cancerous. In fact, it's actually the most common benign tumor in infancy, and it's just caused by a little collection of blood vessel cells that are growing really fast. Now, this next point is probably the single most important thing to get straight right from the start. A hemangioma is not the same as a vascular malformation. Here's the deal. A hemangioma, over on the left, shows up after birth. It goes through this whole cycle of growing and then shrinking, and then it disappears. A malformation, on the other hand, is there right from birth, and it just grows along with the child. That difference in how they behave is absolutely everything. Okay, moving on to section 2, the strawberry mark's life cycle. And honestly, understanding this part is where you'll find a lot of peace of mind. A hemangioma follows a super predictable path, almost like a little 3-act play, from the moment it shows up to the moment it leaves. So this timeline, it basically lays out the entire journey for you. It's really predictable. First, in that first year of life, you have the proliferative phase. That's the growth spurt. Then, from about age 1 to 5, you get the involution phase, which is when it starts to fade. And finally, after age 5, it hits the involuted phase, where it's pretty much resolved. It gives you a clear roadmap of what to expect. Okay, let's break down that first phase, proliferation. Now, this is the part that can be, a little alarming for parents. A tiny little spot can pop up and then grow surprisingly fast in the first few months, turning into that classic raised, bright red strawberry mark. This is a totally normal and expected part of its journey. And then comes the good part, phase 2, the involution phase. This is really the beginning of the end for the hemangioma. You'll start to notice it getting softer, maybe a little flatter. And a classic sign to look for is something called central graying, where the color starts to fade from the middle and then spreads out. That's the mark starting its natural retreat. And that brings us to the final stage, the involuted phase. Now, at this point, the hemangioma itself is pretty much gone. It's been replaced by what's called fibrofatty tissue. But, and this is important, we gotta set some realistic expectations. About half the time, the skin might not look perfectly normal afterwards. It can be a little thin, maybe a bit discolored, or have this unique crepe paper-like texture to it. All right, so we've established that most of these marks just follow their own harmless path. But, and this is crucial, you need to know about the exceptions. When does a simple mark become something you actually need to see a doctor about? But before we dive into those red flags, I want you to just look at this number, over 90%. That's huge. The vast majority of infantile hemangiomas go away all on their own without causing a single problem. So everything we're about to talk about, these are the exceptions, not the rule. So when doctors are looking at one of these, they're really asking 4 key questions to decide if they need to step in. 1, is it posing a functional risk? Is it getting in the way of something important like seeing or breathing? 2, has it ulcerated, meaning has it developed a painful open sore? 3, is it growing in a way that could be disfiguring, especially on the face? And 4, could it be a sign of a rare underlying syndrome? Okay, let's talk about that first one, functional risk, because it's the most critical. We're not just talking about any location here. We mean a hemangioma near the eye that could actually block vision, or one in the airway that's causing breathing trouble, or maybe one on the lip that makes it hard for a baby to feed. In these cases, location is everything, and taking action is essential to protect a child's normal development. Let's put a little spotlight on this one complication, ulceration. Why? Because it is by far the most common issue you might run into. This is when the skin over the hemangioma breaks down. It can be painful, and it definitely carries a risk of getting infected and leaving a scar. If you see an open sore develop, that's your clear signal to call the doctor for wound care and to talk about treatment. Okay, so up to now, we've mostly been talking about the classic infantile hemangioma. But it's worth knowing that it has a couple of rarer cousins out there, and it's good to know about them because they behave pretty differently. And the biggest difference between them? It really just comes down to timing. The common infantile type we've been talking about on the left shows up after birth, but the much rarer congenital type on the right is already fully formed the moment the baby is born. Doctors can also tell them apart with a special lab test for a protein called GLUT1. It's positive in the infantile kind and negative in the congenital one. Okay, there's one other rare one to know about, and it's called Kaposiform hemangioendothelioma, or KHE for short. This one is different because it's a bit more aggressive. It tends to grow into the tissues around it. The main reason doctors are concerned about this one is its potential link to a very serious bleeding disorder called Kasabach-Merritt phenomenon. This is definitely something that requires specialized care. So, with all these different types and potential issues on the table, you're probably wondering, how do doctors figure it all out? And what happens if treatment is actually needed? Well, the good news is, the diagnostic path is usually really straightforward. Most of the time, a doctor can tell what's going on just by looking at it during a physical exam. If there's any question, they might use a Doppler ultrasound to check out the blood flow. And only in really big, deep, or complex cases would they use an MRI to see exactly how far it goes. And that, of course, leads to the big question on every parent's mind if their child's hemangioma is one of the few that needs intervention. What's the plan? What are the modern options? Well, these days, the absolute go-to, the gold standard for medical treatment is a medicine called propranolol. It's a type of beta blocker, and it works by basically telling those rapidly growing blood vessels to calm down and stop growing. It actually encourages the hemangioma to start that shrinking phase early. It has completely revolutionized how we treat the more complicated cases. But propranolol is definitely not the only tool in the box. Doctors have other options for specific situations. For really small, thin marks, there's a topical gel called timolol. Laser therapy can work wonders for treating those ulcers we talked about, or for getting rid of any leftover redness after the mark has faded. And surgery is still a really important option for urgent functional problems or to fix any significant scarring that's left behind. Okay, so to wrap all of that up and pull it together, this little chart here is basically your cheat sheet. The key differences really boil down to timing and behavior. The common infantile type grows, then shrinks. The rare congenital type is there from day one and doesn't grow. And that very rare KHE grows into other tissues and carries that risk of a bleeding disorder. Understanding these differences is so important for getting the right diagnosis. And really, that's the main takeaway from all of this. The journey of a strawberry mark is usually just one of patience and observation. And while the vast, vast majority will go away on their own, just knowing what the red flags are and when to get an expert opinion is what truly ensures the best possible outcome for your child, both functionally and cosmetically. Thanks for tuning in.